Okay, my name is Jamie. I am a nurse at Gwinnett Medical Center.
All right. Working in a hospital, do you have encounters often with male nurses?
It depends on the department. I've worked in several different departments at the hospital, and just depending on which department I'm in, floor nursing versus one of the specialized departments, it varies.
What do you think the ratio is between male and female nurses?
Again, it's going to depend on the department. Usually floor nursing, I would say maybe 1 out of every 10 nurses. You might come across a male nurse. When you get into the more specialized departments, ICU, ER, cath lab where I'm at now, there's probably about 1 for every 3 nurses is a male nurse.
Okay. Do you notice a difference between overall female nursing practice and male nursing practice?
Care-wise, not necessarily. I think just in general, men tend to show affection a little bit differently. Not necessarily affection, but more sympathy and relating to patients a little different than females do. But overall, care-wise, I think I haven't come across any differences between actual patient care. I think the big difference is relating to families and how you show more sympathy. As a female, it seems like they're a little more sympathetic and loving towards patients and families, and the male nurses seem to be a little more task oriented.
Okay. Which do you feel more comfortable working around, male or female nurses?
I'm very comfortable with both. I have great relationships with both men and female. I'm very honest and try and get along with everybody, so I don't necessarily know that I have a preference versus male versus female.
Okay. Have you noticed a difference between responses from patients based on the nurse's gender?
Again, I think it kind of is based on department and the patient themselves. Typically, I've noticed just more in general with older women, elderly women tend to be a little more shy from the men, usually will request a female to be in the room with different types of procedures depending on what's going on. Again, it's just kind of age and gender based. Again, your older females, I've noticed a big difference with them preferring a female nurse versus a male nurse.
Okay. Thank you so much, Ms. Miller.
Thank you.